Hi there, I'm Zara, and I'm going to be your doctor today. How are you today? Yeah, you don't look so great. So it looks like you've got something in your eye. Okay, and you think it's embedded in there. Okay, right. And can I ask what were you doing when this happened? Right, okay. So you think it's something like a little bit of metal or something? Okay, right, okay. Right, well, what we'll do is if I could just have a quick look, if you could just take your hand away from your eye just for a second. Yeah, okay. Yeah, it's very inflamed there, isn't it? Yeah. Dear. Okay, so let me just get some gloves on and then I'll have a closer look, okay? Don't look so worried. Be absolutely fine. We'll get it out for you, okay? Thank you for waiting. I know you have been waiting a long time, but try not to keep rubbing it as well because that will just inflame it even more and make it worse. Right, okay, so it's just this eye over here, so I'm just gonna have a look in it with the torch, okay? Okay, so if you could just keep your head still, and if I could just ask you to look up for me first, please. Okay. And to the side. Yeah, that's it, thank you. And the other side. Okay, and if you could then look down, please. Okay, yeah, just continue looking down for a second. And then just back up again quickly. Okay, yeah, just keep looking up, thank you. That's okay, right. Okay, and I'm just gonna pull your eyelid down if that's okay. If you just keep your head still and just look up again for me, okay? Just, that's it. You can blink if you want, just let me have a look. That's it. Just keep looking up. I think I can see it. It seems to be moving about on your eye, so I don't think it's embedded into the actual eyeball. Can I just have another look? This time if you could just look slightly to this side for me, if that's okay. If you just look over my shoulder there at the chart, thank you. That's it. Okay. And then just look at me, look at my nose. Just having a look to see if I can... Yeah, you have got some other little bits around your eye. It's kind of going to the corner of your eye now, so I think best getting those out first. Just keep looking at me if you can. Look at my nose. Okay, and nothing's in the other eye, it's just that eye. That's great, okay. That's fine. Just keep looking at my nose. That's it. That's great. Okay, I'm just gonna go put your eyelid down again just to check to make sure that there's nothing else in there while we're at it. I think it is that big piece there. Okay, just keep still a minute, thank you. Right, okay. That's fine. So I can see the big piece, and there is quite a lot of debris around as well. So somehow there's quite a few little bits left in there. So let's just, now that I've got this, I'm just going to take some details so that we can start the treatment. So if you can just confirm your name for me, please. Okay, and your date of birth? And your address? Yeah, I've got you here, okay. Right, so let me just get my gloves back on. And we're going to get those bits of debris out. And then we'll see if we can do a wash to get that big bit out. Okay? Yeah, just relax, okay? It's going to be fine. You just sit there. Right, so first of all, I'm just going to get this, and I'm going to just wipe your eye, okay? Just to get those little bits that have come to the side now, just so that I've got all out other than that bit, okay? So if you could just keep your head still. I'm just going to place my hand on your other cheek just while I wipe this out, just to keep your head still, okay? You ready? Okay. Okay. That's it, you're doing great. So just that last bit there. I think that's most of it, okay? Let me just have a look. Just going to get the torch just to have another little look. Okay. Yeah, let's just get this one there. That's it. Okay, that's it. Just keep looking straight at me, at my nose, just so that I can... That's it. Okay. Right, that's all the debris now, I think. That's it, okay. I know it's still feeling a bit sore for you, but please don't rub it, okay? That's great. Okay, so what we're going to do now is I'm just going to do a wash of your eye, just so that we can see if we can get it out with washing it, okay? And then if that doesn't work, then we'll have to go on to the next step. The next step would be, if we can't get it out with a wash, we would try and get a bud, and I would have to gently swab your eye to try and get it out. And then if that doesn't work, then it may be embedded in your eye, and we would have to go to implements then. But hopefully we won't get that far, so just don't be worried. Okay, so what I'm going to do is I'm just going to use my magnifying glass so that I can just ascertain how big it is and it's not moving around too much, so that I'll be able to get the wash in on the right spot and get it out for you. So if you just use my light again, okay, if you can just look over at the chart again for me, and I'm just going to put this magnifying glass out, okay? Okay. That's great. Oh, sorry. Right, so this is going to just be a wash for your eye. So I'm just going to make the droplets in there, and if you just tilt your head to the side, and we'll hopefully be able to wash it out. So if you try and keep your eye open as much as you can when I put them in, if you do blink, then that's fine, that's good, because then that's your eye's natural way of trying to get anything out of it. And then hopefully it will come out, and we'll have another look then, and then we'll assess, okay? So this is just an eye wash, okay? It's not going to hurt, it's not going to sting. It just might be make your eyes blink, but that's absolutely fine, as I said. Okay, so if you could just, when I'm doing it, if you could just look up, and then I will catch whatever drops come down there onto this, okay? Are you ready? Okay, right, yeah. If you could just tip your head back slightly and then look up for me. That's great. Okay, are you ready? Just keep your eye open, and the first drops are coming now. That's it. That's it. Just keep your eye open. A lot of liquid's gonna have to go in it now. That's it, and then blink, blink. And the last bit. That's it. Okay. Right. Perfect. Well done. Okay. How does that feel? Let me just get that. You just got some on your cheek there. Let me just get that there. Well done. Okay. How does that feel now? Yeah, it's still going to feel irritated because you've been rubbing it so much. But yeah, I think it still might be in. So yeah, let's have a look at the torch again, and we'll be able to see if we have to go do the next step. Okay, yeah, try not to rub it, please. Just okay. Are you ready? I'm just gonna have another look. If you could just look at me and look at my nose again for me, please. Okay. Yeah, I think it's still in there. Let me see if you could just look up for me, please. Yeah. If you could just look to the side. Yeah, I think it's still in there. Yeah, I can still see it. It's hard to see with all of the bloodshot there as well. But okay, right. So the next step, it'd be if I use a little bud to try and get it out with a bud there. So what we will do is we would put a numbing solution into your eye. Now, it won't hurt and it won't sting again. It just might make your eye feel a little bit funny. And then I will use a bud to just try and move it away and move it out of your eye, okay? Now, if that doesn't work, obviously we'll then have to go to the next stage, but I'm hoping that it will work. So, should we put this numbing solution in your eye and it'll just take about 20 seconds to work, and then we can go ahead and I can try and get it out of your eye with this bud. Okay, are you happy? Great, you're doing really well, okay. This ordeal will soon be over, okay. So this is the numbing solution, and again, I just need to put a couple of drops in your eye, and then we'll wait for it to work. So I'm just going to put this under your eye again to catch any drops. Okay, if you could just put your head back slightly, and then I will put these in. That's it, great. Just a couple of drops needed. 1, 2, 3. That's great. Okay. So we'll just leave that to work slightly. So if you just sit back and relax, and we'll wait for that to work, and then the bud is just like this. It just looks like an earbud that you might use at home, and it's just slightly wet so that when I go over your eye, then hopefully it will pick up the fragment that's in your eye and get it out for you, okay? So we'll just leave that to work slightly. So has this kind of ruined your plans then? Oh dear. Well, there's always next weekend, hey? Okay, does that feel like it's done anything? Yeah? Okay. Just give it a couple more seconds just so that we know that it's working. Okay, so it's very important during this procedure that you keep your eye open as much as you can for me. I know that you will need to blink, so that's fine, and it is also very important that you keep your head very, very still, okay? So my hand is going to be on your other side of your face, just so that I can stabilise your head to stop it from moving, and then I will be using my other hand as well to stop you from moving as well, but try and be as still as possible, okay? And while I'm doing it, if you could just fix on a point on the wall, so if you have a look at that chart, fix on a letter, and then I will try and get it out for you, okay? So I am just gonna have another quick look so that I know where I'm aiming for. I'm just gonna use the torch once more, and then once I've got that, I'm gonna go in. So if you could just look over there for me at the chart, and I'm just gonna make sure that I'm aiming for the right place. Yeah, okay, I think I've got it. Right. If you can just keep very, very still, and then I'm just going to literally, are you ready? Yeah, okay, so just look at a point, and I'm just gonna literally just swipe it, okay? 3, 2, 1. Okay, just keep still. Don't move. That's great. I'm just gonna move your eyelid down a little bit. Just keep still as you can. Wonderful. I know. Yep, just blink, blink, blink. And then nearly got it out. Just a little bit longer. That's great. I think I've got it. So just blink, 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 blink. That should hopefully clear anything. So yeah, I've got it here. It looks like a black fragment of metal or something. So yeah, use eyewear next time because your eyes are very, very precious. Okay, so I think that's out. Does it feel better? That's great. Okay, so I'm just gonna get the torch out again, just make sure that it's out completely and that we've done our job, and then we'll just do some eye tests to make sure that both eyes are absolutely fine and there's not been any ill effects from the fragment going in. Okay, so if you just look up for me. Okay, and look down. Wonderful. Okay, you're doing great. And then just look to the side for me. That's great. Perfect. That's great. And the other side. Oh, great. Okay. Fabulous. Yep, that looks all clear now. Does it feel okay? Great. Just wonderful. Okay. Perfect. So that wasn't too bad, was it? No. That's great. Okay, no problem at all. Don't worry about it. Okay, so now just gonna do a couple of tests while you're here, just to check on your eye health, make sure that there's been no ill effects to having something in your eye. So I'm just gonna test both of your pupils. So I'm gonna shine this light in your eye and just gonna check your pupil reflex just to make sure your pupils are all fine. Okay. So if you could just look at my nose while I'm doing it. Okay. And the other eye. Fabulous. Well done. Okay. And then if you could just carry on looking at my nose for me. Thank you. And if you could just look at the top of my head. That's it. Thank you. That's great. Okay, fabulous. And then if you could just look at the chart over there, if you could just focus on one of the letters there. That's great. And then look at my finger. That's great. Look at the chart. And then look at my finger. That's great. Look at the chart. Look at my finger. That's great. And one more time, look at the chart. And look at my finger. Just one more for good luck. Look at the chart. And look at my finger. That's great. Okay. Fabulous. Okay. If you could just focus on my nose, and then can you tell me which one's wiggling? Do you know your left from your right? Great. That's great. Thanks. Okay, and my nose. Which one's wiggling? That's great. And which one's wiggling? Okay. Okay. And one more time. That's great. Okay. That's fabulous. So, if you could just keep looking at me, I'm going to just cover one eye, and then I'm just going to bring my finger into view, and you tell me when you can see it coming into view, okay? So, just going to, we'll use this. Are you ready? Great. And we'll swap eyes. We put it on this one. Wonderful. Okay. Okay, so if you could just look at me to start with, and then I just want you to keep your head still. If it makes you feel better, you can hold it with your hands. And then I just want you to follow my finger with your eyes only, so don't move your head. Okay, great, understand? Fabulous. Okay, so look at my finger, and if you can just follow it, please. Don't move your head. Wonderful. That's great. Great. Okay. So, are you experiencing any double vision or pain while you're doing that? No? All good? Yeah, obviously that eye will be a little bit sore, but that's just from something being in it and from you rubbing it as well. Okay. So, if you could just look at that chart, and again, I'm just going to use the torch to see reflex. So, are you ready? Look at the chart. Thank you. Keep looking at the chart. Thank you. That's great. Wonderful. Okay, well done. And then if you could just look at the chart, and if you could read this. Let me get my pen, easier to point. Can you read this line for me? Okay, do you think that you can do the one below? Fabulous, that's great. Okay, and if you cover one eye, we're going to do it again. So again, I'll get my paper and I'll use it to cover your eye. So look at the chart, and if you could just read this slide for me. Okay, and read. That's great. Fabulous. And then I'm just going to cover your other eye, if you could do the same and see if there's any difficulty. That's great. Okay, so there's no difficulties in your eye that you've damaged, and your eye health seems to be fine, all your reflexes are working properly. There's nothing else that I'm concerned about. So I think what you need to do is just, maybe go home and have a little doze, have a little sleep, and then in the morning, hopefully all that bloodshot will have healed up a little bit. And then obviously if you have any concerns at any time, then you can come back to us and we'll have a look. But it does look like that everything is out now. As I said, I would advise that you use eye protection next time and in the foreseeable future, because your eyes are very precious. If it had been worse, then it would have been more of a procedure. We would have had to actually get like a little needle to get the piece out of your eye, which is, when you've numbed it, it is not very pleasant, but it is not too bad a procedure. But hopefully we didn't have to go down that point. So your eyes do look like they're absolutely great now. So please do just be careful next time, and hopefully I won't see you here again. Okay? Any questions? That's fine. That's great. Well, thank you very much for being a great patient, and all the best, okay? Yeah, no, you don't have to put anything in it. No kind of eye drops or anything. Just leave it to kind of heal. It will be slightly sore for the next couple of days. Okay.